Video content or information here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Please also see the written disclaimer with more details below. Thank you. Hi, I'm Dr. Carrie Bennett, and I'd like to talk to you about inflammatory breast cancer. I have many patients that I've had for decades that have inflammatory breast cancer. Inflammatory breast cancer is not something that we know how to prevent and is incredibly rare. It is a clinical diagnosis. So while all the other forms of cancer, of breast cancer that we have, it's from a mammogram, ultrasound, and we look at it pathologically. In inflammatory breast cancer, we will also usually get in pathology to confirm the diagnosis, but it is what we call a clinical diagnosis. That is, someone like me looks at your breast and says, I think you have inflammatory breast cancer. And then we do a small biopsy with a small round incising device called a punch biopsy. And we make a small round incision in your skin going through the different levels of the skin into the subcutaneous tissue. And we send that to pathologists to confirm our diagnosis. I can tell you that I have many times walked into the room just meeting someone and unfortunately had to say, hi, my name is Carrie Bennett, learn who they are and say, I'm sorry, I believe you have inflammatory breast cancer. While most breast cancers are treated with surgery as a mainstay of therapy, inflammatory breast cancer is different. So inflammatory breast cancer is usually treated by medicines, sometimes not ever treated with surgery. Certainly if the disease spreads outside the breast and is what we call distant disease, going to the brain, the bone, the liver, or the lungs, surgery does not help those patients with their survival or their any kind of disease-free recurrence. That would be a chronic disease. Then there's local disease, which means it's in the breast or the arm and the armpit. And then localized disease, meaning the inflammatory breast cancer is limited just to the breast. It's a clinical diagnosis, and often when people get mastitis or breast infections, people worry that it might be inflammatory breast cancer because inflammatory breast cancer can look like an infection. Often people who present with inflammatory breast cancer will have been treated with antibiotics and the redness has not gone away. Or someone will believe that they've bruised their breast and they wait for it to resolve, but unfortunately it continues to get worse. It can be an aggressive disease that can be rapidly progressing. And classically, when we look at the breast, it's red and has what we call peau d'orange, or that's French for skin of an orange. So it looks like a orange-red tissue and it becomes thicker and harder. Some people report pain, but most people do not report pain. As we've talked about before in a different video, breast cancer usually does not cause pain, but pain is there as a sign to pay attention inward now, and the treatment to help get rid of breast pain, which is usually secondary to nerve irritation, also helps prevent cancer. Inflammatory breast cancer is staged, and you can look at my other staging video, as a T4 and then N either 0, 1, 2, or more, depending upon where it falls, whether or not we can feel a lymph node, biopsy a lymph node, and whether or not they're matted together. And it usually starts as a T4NX, meaning we don't know. We can look at it clinically and say, yes, it's through the skin, so it's a T4 lesion. NX, meaning we're not sure about the nodes, but we will continue to look at that. And then MX, and then but we hope that it hasn't spread. So then again, we're looking to see if the cancer is localized to the breast, the lymph nodes, or has gone outside the body. Inflammatory breast cancer is initially treated by different chemotherapy drugs. And if it's a localized disease or regional disease, that is just the breast or the breast and the lymph nodes, then sometimes patients will be offered a full mastectomy. Patients with inflammatory breast cancer do not benefit from a partial mastectomy, formerly known as a lumpectomy. Also, we cannot do surgery usually when it first presents because the tissue will all fall apart. The cancer will continue to spread because we can't put tissue that has cancerous cells in it, or the skin having cancerous cells in it, back together, the body won't heal. So it's treated with the chemotherapy. Then certain patients with localized or regional disease may be offered a full mastectomy with removal of some or all of the lymph nodes, called a sentinel lymph node dissection or axillary lymph node dissection, depending on how many lymph nodes appear to be involved, often by physical exam and ultrasound before surgery, and usually before chemo, that we know what you started with. We may biopsy your lymph nodes as well before with ultrasound to see if you're an N0, N1, or greater. So backing it up, slowing it down. Inflammatory breast cancer is a clinical diagnosis initially treated by medicine. If people have disease that's localized to their breast or their breast and their armpit, those patients may benefit from a full mastectomy with removal of lymph nodes, and then followed by radiation therapy. So inflammatory breast cancer is incredibly rare, and you can tell by looking at the breast often whether or not, and that is a clinical diagnosis, someone like me saying, yes, this is inflammatory breast cancer, and then proving it. Thank you.